One of the major issues in addressing the problems with the healthcare system is in how information is received, specifically when it comes to facts versus opinions. In today's mainstream media, facts are often blurred by these opinions. We also see healthcare and health insurance discussed as one and the same, when in reality they're two very different things. And to properly address them, we must identify them accurately. Regardless of which outlet you subscribe, here's the truth. The healthcare system is in fact broken. While we have discussed this previously, to summarize why and how the system is broken, it's because each part of the healthcare system continues to feed off of and grow from other parts. The federal government continues to try to fix the system, be it the Affordable Care Act or the American Health Care Act, but in their recent attempts to change it, these legislative pieces really have only impacted one major part, and that's health insurance. Health insurance is no longer the transfer of risk, rather the financing of it. And while the ACA and the AHCA both have admirable parts within them, the end result is that since the passage of the Affordable Care Act, health insurance companies have actually gotten bigger, and the costs associated with accessing healthcare have continued to go up significantly. According to the Centers for Medicare and Medicaid Services, the national health expenditures per capita in the United States went from $147 per year in 1960 to over $8,400 per year by 2010. In 50 years, healthcare grew from 5.2% of gross domestic product in the United States to nearly 18%, with continued projected growth both today and even into the future. Over the past 50 years, many administrations have tried to do something about the rising cost of healthcare. In the second half of the 20th century, the primary focus was on the delivery system itself and trying to reduce costs by having healthcare providers join insurance networks. In essence, the idea was that health insurance companies could steer people to specific doctors and facilities, and in return, those providers would discount the cost for their services. This resulted in preferred provider organizations or PPOs, point of service plans, and the expansion of health maintenance organizations or HMOs. In 1999, when I entered into the health insurance space, there were literally dozens of health insurance companies in each market, and many more throughout the United States, all with their own private networks, discounts, and ability to steer patients. Fast forward to today, and in most cases, there are only one or two carriers in any given market, sometimes a few more, but more often than not, the providers within that market are in network with all of the specific carriers that are accessible. In short, network steerage doesn't matter anymore. And in reality, neither do network discounts, as providers now factor in those discounts when establishing their base rate or fee for service. The turn of the century ushered in our nation's attempt to control healthcare costs by incentivizing the users of healthcare. During this time, we saw an expansion of things like flexible spending accounts and health savings accounts. The hope was that consumer-driven healthcare would impact the cost because we, those that use the system, would be better shoppers of healthcare because we would be using our own tax-free money to pay for it. Again, the intent was admirable, but today most Americans are living paycheck to paycheck and unable to save any money, be it for healthcare or anything else. In addition, there's limited transparency within the healthcare industry, so shopping for the best deal can actually be quite difficult. In 2010, the focus shifted from the provider and consumer market to the finance market, health insurance. The hope of the Affordable Care Act was that costs would go down because government would mandate that all citizens have health care, provide subsidies for those that couldn't afford it, and since insurance companies would have more policyholders, they would be able to spread risk more effectively, thus bringing down insurance premiums. Provisions within the ACA also stated that insurance companies must use specific amount of what they collect in premiums to pay for claims. This was known as the managed loss ratio portion of the bill. Again, while the intent was good, the ability to execute and impact was not, as premiums are a derivative of actual healthcare cost. So when you don't address the driver of cost, the financing of it just goes up. I've used the analogy a number of times that it was if the law said, we don't care what you charge for the car, just what your finance rate is. The result of the Affordable Care Act is that the stock prices of the largest publicly traded insurance companies in the United States has gone up on average more than 200% since the ACA's passage. Additionally, we have seen more consolidation within the available insurance carriers, and so the costs of both health care and health insurance have continued to rise. And since insurance companies now are limited on the percentage of money they collect to be profit, they need to collect more of it so that they can provide a better return to their shareholders. To ever have an impact on the healthcare system in its entirety, we must simultaneously address all three of its parts. Part one is the providers, doctors, facilities, pharmacies, and so on. Part two is the payer system, which are insurance companies themselves. And then part three is the patients, that's consumers like you and me. From a political standpoint, as I mentioned in our first video, our country finds itself more politically divided than ever. Unfortunately, we don't see a legislative branch willing to address real problems or even work together. Rather, they focus on winning the day, the next election, or the next argument. Healthcare is a real problem in the United States, and it's not isolated as a Republican or Democrat problem, rather a nonpartisan issue that will take real action, sacrifice, and strategic solutions to solve. While originally very unpopular, the Affordable Care Act provided some real positive framework for solving the problem, but quite frankly, it didn't go far enough in most areas and too far in others. There are also some admirable aspects of the American Health Care Act that could be implemented as well, but both have their pros and both have their cons. The biggest con of both pieces of legislation is that they just don't go far enough when it comes to the actual cost of healthcare. Unfortunately, the legislature is more focused on victory than less on solution. And until we get to the point that we can work together, I fear that the problems will continue. Most of the focus in the rhetoric these days is on the individual market. Many of the provisions within both the Affordable Care Act and the American Health Care Act focus on the individual market and trying to make coverage more accessible within it. In reality, the individual market is actually the smallest piece of the entire health insurance delivery system, yet we focus most of our time on it. A recent article in the LA Times sourced a study which showed that within the United States, roughly 47% of the population get their health insurance through their employer. Another 17% are covered by Medicare, and nearly 23% of the population is covered through Medicaid or CHIPS program. In all, approximately 87% of the entire population in the United States are getting their individual health insurance or getting their health insurance coverage outside of the individual market. And while it's very important to address the issues within the individual market, only 2.9%, just over 9 million people, are getting their coverage there. And yet, it seems to be the primary focus of the entire discussion surrounding healthcare. If we really want to focus on solutions for problems we face, we must consider the delivery systems in which coverage is obtained and address those areas in a realistic manner. As we begin the process of outlining our solutions, it's imperative that we understand these facts and data points so that we can address the real problems with real solutions. The solutions that we will begin laying out today will address these issues as well as others head on in the hopes that we can work to cure healthcare in the United States.